Hi team, it's very happy evening to all of you. So very happy to meet the new participants. Very nice to meet all of you. So furthermore participants are joining. So just let's wait for 1 more minute. So so today actually we are going to talk about the NLP program which we have planned. That is the main aspect because I got inquiries from many people, sir, what is to be done, how to enroll, and all those aspects. See, the 5 days NLP program absolutely free. For the training program, we are not going to charge anything. But the only one thing which we request you to do is share it with your people. Share it in your WhatsApp or share it in your Facebook or share it in your Instagram page. Because it will help the other people. See, I assure you the 5 days will be one of the wonderful days in your life. I can assure you that because we will cover one of the finest aspects from NLP. It will be a thorough professional program. As if we are conducting the paid program, the same amount of effort we will be putting. And you are going to learn from me and also from my other participants, my other trainers. So the thing is, it will be of world-class standard. We call it as a dynamic NLP. It is not NLP, it is dynamic NLP because you will be learning things from the various angles. NLP, a 360-degree approach. In NLP, we call it as map is not a territory. So even that applies to the NLP also. Even for NLP, the same principle applies. So we will be talking from all the perspective about NLP and some of the beautiful aspects, techniques from NLP we are going to see it. So what are the main aspects? The one is you may be in some WhatsApp group, there the link will be shared. That is the first thing. The second thing is already we are sharing the link to you. Already we have shared the pamphlet to you, the flyers to you. We request you to share it with your people, share it with your friends so that they will also get the benefit. Mostly it happens that okay, why we have to share? Even one person has asked me in the personal window, sir, is it necessary to share? Now, I will not recommend. I don't request the people who are joined for the first time with me. For example, you are attending this program for the first time in Emocare. Okay, don't share anyone. I don't want you to share. But there are a few people, they have attended all the free programs. They don't miss even a single program. Okay, and I want them to share. And we will not be sharing the link to everyone. If you are existing participant, again, if you are joining in this 5 days program, that means you are satisfied with the Emocare training presentation. Okay. Then if you tell, no, I will attend the program, I want to enjoy the program, I want to improve myself, but I will not help you in taking the program to outside, we will not share the link. So we have been saying there are many people who have already attended. For example, art therapy 3 days we did, mental health practitioner program we have did, and all those people we have taken it. We will be creating on 4th evening. Whoever has shared the existing participants, I am talking about the existing people. The existing training you have taken, art therapy you have attended, mental health practitioner, hypnotherapy. There are various programs we have conducted. There are some people, they attend all the free programs. I welcome you. You respect my free program, I respect you. But the thing is, I need something in return. That is, you share it in your WhatsApp groups or you share it in your Facebook or Insta. This is, I expect in return. I don't think it is a false because you attend this program NLP 5 days because you are satisfied with the performance of Emocare. Satisfied with the performance of global trainers and counselors and coaches organization. You put, you like it. In that case, if you are an existing member, If you are not shared and shared the link to us, we will not include. New person, you are attending the program for the first Emocare, which GDs you. You need not share anywhere. After the 5 days, you can understand. Okay, what is the quality of the training? What is the quality of training and how they deliver it? And afterwards, whenever we conduct next time program, if you want, you can share it. So this is the crux of it. So many people they ask me whether it is compulsory. If you are attending the program, if you have attended even one program with me, if you have not shared, you will not be added in the group. I will tell you frankly, because see, you have attended 3 programs free of cost, and 4th program also you want to attend. That means you are satisfied with the output. Then we also expect something in return. Okay, this I candid statement I make. If you are an existing participant, if you are not sharing, we will not share the link to you. The 5 days program, we are having certain aspects. Now, let me come to the act. Okay, let me come to the act. The National Commission on Allied and Allied Healthcare. It has been passed in the Rajya Sabha. Now it has to get passed in the Lok Sabha, and then it will become an act. When it becomes an act, what are the repercussions for us? What are the repercussions for us? Now we have to see certain things in it. It is not that we have to just read it. Sir, I have seen it, sir. Now, even now, before this program, I was talking with one person, okay? And she told, sir, I have seen, sir, even they very clearly told that RCA is not coming under this picture. This act, it doesn't talk about RCA now. That means people are just like that, sharing whatever they want. This act, it is not talking about RCA. It is not talking about RCA. It talks in only one place. It says psychologist. Here in this act, the clinical psychologist and PWD, those registered, they will not come under this one because it is maintained separately. RCA was never playing any role in counseling. It never played. It never played. If you go to the objective of RCA, you will be able to see very clearly that it is into rehabilitation and they maintain it very nicely. So this act, it is not talking about anything related to the rehabilitation. It talks about something else. So when it talks something else, it is talking about something else. What are the repercussions we have as psychologists, as a life coach, as NLP practitioner or NLP master practitioner? There may be people who are practicing acupuncture, okay, Reiki. So what do you have? Why that you should be bothered about this program? Why should you be bothered about this particular act? Why that you should have a complete understanding now itself, so that you can safeguard yourself from now onwards. Before it becomes an act, you can keep yourself ready. That is what expanding the map. From the NLP angle, we are trying to expand your map as far as this particular act is concerned. So I'm going to talk about one aspect, and we are going to discuss completely about this act. Each and every para we are going to discuss in the ensuing days. We have planned certain programs, even along with the senior members we have arranged. So we will be sharing the link in the groups. So whoever is interested to take part, they can take part. For today, I will tell you one aspect. Okay. See, as far as the act is concerned, it talks about 2 aspects. One is allied and healthcare professionals. Okay. The another one is healthcare professionals. 2 aspects. Allied, that is one thing. The another one is healthcare professionals. For allied and healthcare professionals, they need 2,000 hours of practice and a diploma. 2,000 hours. In that aspect, it clearly states full-time degree is required. In allied and healthcare professional, if you see, the act clearly says, You should have got the 2000 hours only from a regular mode. If you have done it through correspondence or something, it is not eligible as per that. As far as allied and healthcare. In allied and healthcare, who and all will come is whoever is working in a hospital who is not doctor. For example, sonography. There are many healthcare people, those who work in hospitals. They all comes under this allied and healthcare. So they should have 2000 hours of diploma mandatory. That is mandatory. That is full time. Distance mode is not applicable. It is clearly stated. But as far as the healthcare professional is concerned, if you read it clearly, it says you should have 3600 hours of study. You should have 3600 hours of study, 3 to 6 years span. 3 to 6 years span in semester pattern. But they don't tell the regular mode. The word regular mode is mentioned in the allied and healthcare professionals. It is very clearly mentioned that it is you need a degree from a regular degree. It is very clearly stated. But in healthcare professional, the word regular mode is not available. The people who do it through distance education and all, whether it will get covered or not. That is one aspect. The second aspect is it clearly states 3600 hours you should have, which you should have finished from 6 years to 3 years to 6 years span, and it should be under a semester plan. Now all your degrees, if you are doing it through correspondence, it is not semester pattern, that is yearly pattern. So how it is going to be differentiated only when the act becomes, we will know. But as far as we are concerned, we have to take some precautions now itself. Expand the map. So NLP says expand your map. So now itself we have to expand our map. So hereafter, whatever certificates which we are going to give, Emocare is going to give, okay, we will be mentioning the hours clearly. Because tomorrow they will be opening a separate state level mechanism wherein you have to upload your documents and you will have to upload the hours, because it clearly states you need 3600 hours of study. So 3600 hours means you should have 550 days of 7 hours study. If every day if you spend 7 hours, 550 days, it comes around 3700 hours. That means a 3-year study and 2-year study, UG and PG, UG and PG. But here it is not very clear whether correspondent distance mode, whether it is eligible or not. It is not that much very clear because that word is not available. But semester pattern it is available. But it is very much important that we should safeguard ourselves before the act becomes, before it is passed in the Lok Sabha and becomes the act. So as far as Emocare is concerned, the training programs which we are going to do hereafter, we will be mentioning the hours very clearly. This is the hours, it is clear. There is one column which states that whoever is practicing at present, based on their aspect, they may be given chance. That is up to the commission. So many things are going to come. There are many things are going to come. So we have to prepare ourselves. So these are the aspects just from that act which I wanted to discuss. So it says we are all behavioral health science, behavioral health people, professional, behavioral health professional. So it is being the number which is given is 2634. It is given there. So there are many aspects is covered. The last page of the act, if you go, it covers many aspects. But only psychologist is covered. For example, if you go to the schedule, if you go to the schedule, section 2R, if you go to section 2R, It talks about what are the different disciplines for which it is going to come under this. In that, if you see, it is not talking anything about sujo. Physiotherapists are covered. But physiotherapists, if they do acupuncture and sujo, whether it is covered or not, it is not given. That is one thing. And apart from that, as psychologist, only psychologist it is given. Okay. But apart from psychologist, all other aspect it is not given here. For example, if you take behavioral health science professional, okay, behavioral health science professional, it comes under 7. It comes under 7. It says a psychologist, except clinical psychologist covered under RCI and PWD. Okay, then they call it behavioral analyst, integrated behavior health counselor and counselors including disease counselors, diabetes educators, lactation consultants, social workers including clinical social workers, psychiatric social workers. Okay, then family planning counselors, mental health support workers. So these all are the aspect covered. One more aspect it is covered here is uh, movement therapy, and art therapy. Expressive therapy they have written. Okay, movement therapist including therapist or a recreational therapist, which pertains to art, dance, and movement. These words are clearly written. Okay, so art therapy, it may have it will get accredited. Therapy, if you take particularly art therapy, it is not conducted in any government institution. So here in the first few aspects, if you see, it says a university, college, or institution. It uses the word institution. So a registered institution, if they conduct this kind of programs, they may accept or they may not accept. That we may not tell now. But once it gets the once when it gets in the form of act, what is going to come? That we have to wait and see. But it is better that we will prepare ourselves. So hereafter, whatever certificates you will get, wherever you are working, ask them to put the hours. Ask them to put the hours very clearly. That is what, because it clearly states 3,600 hours. Okay. So if you take it in hours, it is very nice. They may put in days, take it in hours also. So even in our dynamic program, which we did it for 80 days now, we have included. We have not included the date. We have stated only diploma. So hereafter, whatever training program we are going to conduct, we will be putting hours very clearly, and we are planning to conduct a 6-month program, because I think definitely it may take 3 to 4 months to become an act. Okay, so immediately we are planning to take a startup course of 6 months, wherein we will be able to do a regular program. It may be like a regular program. I am seeing the various viabilities. Suppose if there are people from Delhi, in Delhi itself, they can attend the program. So we are having Emocare is going to start the franchise very soon. So within a week, we are trying to arrange at least 4 places, direct program of 4 to 6 months before it becomes an act. So that the particular hour, for example, 7 hours per day into 3 months, okay, it gives a very good hours. Maybe it may be useful when you are giving for what you call recognition. I am not telling here when you do this you will get recognition. No, I am not telling. I repeat, I don't tell. I do not know what is going to come. It is better to prepare ourselves. So even the NLP program which we are going to give, it will come with the thing that it is hours. How many hours you have did it? It will come along with that. And also the word free will not be available in the certificate. The certificate will not have the word free. Okay, it will because we are going to conduct the way in which we are going to conduct the regular programs. Okay, so existing participants who have attended any program from Emocare, if you have not shared it in your FB, Insta, and added your friends, at least minimum 5 people, we will not be sharing the link to. Okay, whatever may be the case. New people who have joined only now, sir, I do not know Emocare, sir. Now only we are joining. You need not share anywhere. Attend the program. Really, you will like it. We will be adding the new people in the group. Even new people, I request you people, if you have some good members, please share them these good things. Good things has to go to many people. Now, as far as NLP is concerned, why that we want to create awareness? As far as NLP is concerned, there are many minds. People think that only if you get a certificate from foreign university, it is approved, or foreign, America, these, that, nothing like that. See, whoever conducts the program in foreign countries also, they are only private body, they are not government body. No government in the world has approved NLP, has approved for that matter any psychologist. Any psychology, everything is only theory. Psychodynamic approach by Freud, it is only a theory. It is not evidenced science. So theory, no theory has been approved by any government. Okay, that this person will authorize for this. No government anywhere in the world has told. So NLP is also like that. The only thing is, I know many people who have spent 2,60,000, 3 lakhs to study NLP, and now without any job they are sitting. And one person even called me and told, sir, I want counseling. I asked her, okay, may I know about you, sir? So he told, sir, I have completed my master practitioner in NLP. I'm not getting any clients nowadays. Then there is no use of doing the master certification. No? Then I asked him, where did you do? And he told some person, and he has spent around 2,60,000. The thing is, it is not where you take the certificate, NLP. It doesn't matter whether you are practicing NLP. When you practice NLP, NLP will give you success. NLP, you learn it from anyone in the world, and you don't practice, you will not get success. You will not get success. You learn from the topmost person in the world, who is the authority for NLP. And if you don't practice, it's going to be utter failure. For that matter, I am telling you, you don't attend any program, even Shokumar program, you don't attend. Just by listening to the YouTube, you start practicing NLP. It will give you success. There are many myths about NLP. There are many misconceptions about NLP, which we want to remove. Not only NLP, there are about many aspects. Even in the healthcare, the thing which has released by Rajya Sabha, cleared by Rajya Sabha, people are having many doubts. So we thought one by one we will clear it. So today we have started just the first 2 lines. The first one is 2,000 hours. It states, it really clearly states regular mode it is required. And as far as the healthcare professionals, it says 3,600 hours to 3,600 hours and more, spanning around 3 to 6 years. In the semester pattern, but they have not used the word regular mode. They have not used it. So maybe even distance mode also they may consider. Only when it comes in the act we may be knowing it. But it is always better ourselves, because I know there are many people who are practicing as life coach and other aspects. They have studied only through a distance mode. So all have the worry whether I will be able to do this or not. As far as the act is concerned, what the act says, we will discuss. Maybe once in 3 days, I will be talking about in depth about every line. We'll discuss about every line we will discuss. Now, I do not know how many of you have so far seen that regular mode is available for allied and healthcare. Whereas for healthcare professional, that word regular mode is not available. I do not know how many of you have seen it. If you have not seen it, that is what we are going to bring you. Emocare wants to bring you the up-to-date information to the people. Okay. If you are Emocare is a private institution. GTC. There are some people websites claiming that if you do registration from us legally, you can do counseling. No. Nobody in the world can say like that. If you got a certificate from a private body and if you register, whether you will become legally terrible? No. Even that particular people also, they are also private only. They are not government. They are not government. So we don't want to cheat the people. We want to give you the clear-cut information. So thank you very much, team. I will just read your comments, and if you have any doubts, I will clarify. Thoughts are for mental health practitioner, Sharmin Sultana. Shamin Sultana, mental health practitioner, the second level, basic level free we have done. The second level, it is not free, which we are going to start. We will tell you soon. But for that, the dynamic will be much more good. Dynamic counseling and coaching certification. It is going to start on April 15th. And we will be giving the certificates with hours, how much hours you will be covering. And it is not actually the training. I will be talking with you for 1 hour, but you will be practicing more hours. So only that hours will be taken into consideration for certificates, and all those things will be what you call documented. Because tomorrow people should not say, "No, sir, you are putting some hours. How in 70 days you have conducted the program? How this much hours will come?" Then I can show the document. No? So there will be document evidence for everything. We are going to devise the program in such a way that it gives some good hours when you submit the certificate to the authorities. So thank you very much, team. Can we get a government job after doing MPhil from any university other than RCA registered institutes? Yes, definitely. I know many people who, after completing degree from Indira Gandhi National University, Open University, they have got RCA. It is about rehabilitation. For rehabilitation, definitely you require a degree from that. Rehabilitation means the people who are suffering from the rehabilitative nature. For that, you should have a degree only from RCA. So, any other details if you want about NLP, sir? I am BDS doctor from Bangladesh. I have completed your diploma in practical counseling. I want MS. Which subject is best for mental health practitioner? Sir, Sharmin Sultana, people do the thing from government institutions. Okay, mine is a private one, but we concentrate on more on the practical aspect. But when you want to do it on a for your own future and all, always a government certificate is preferred. At this particular point of time, it is better to see where you get more hours of study. That is always nice. So I will share some of the informations on this aspect also in the coming days. So any other thing which I missed, just I will see it. Acha, okay. So if you have any doubts, you can put it. I will answer it. Otherwise, we will end the program. So NLP is going to start on Tuesday. Happy Holi to everyone. Holi is a time to celebrate. Happy Holi to everyone. Tuesday, we will be starting the NLP program. Please share the information with your friends and relatives and everyone. Thank you very much, team, and subscribe to the channel if you have not subscribed. So some organizations mention 1 month or 1 week training, but with just 1 or 2 hours per day. So the total number of hours come together only 30 hours. How this is viewed in terms of training hours? Yes, Suryashri, that is what I am telling. Hereafter, when you do the training, okay, go for the hours till it becomes an act. After it becomes an act, but even if a private institution, if they put the hours now, it is not going to have any impact. No, before it becomes an act, the hours, it is going to play the major role. So in the coming program which we are going to take, because when I am conducting a program, I give homework to the people. The homework they consume around 3 hours. The 3 hours is also a part of the study. Even though I am not taking the class, it is part of the study. So that also will be included. Apart from that, we are going to have individual sessions in the respective places. Delhi, Mumbai, Bangalore and Chennai, we are going to start it so that the diploma, the people who are doing diploma, it will be a regular program. It is not a online program. It will be both the modes, online and offline. So the respective hours will come, and we will also have the documentary proof for the hours. It is not that just we put the hours. So hereafter in all our programs, we are going to implement this. including the NLP program. Even though if it is free, we will clearly mention the hours spent by the individual, but they should have spent. They should have spent the hour. We will be seeing everything. We will just like that. We will not give the certificates. We will see everything, and we will give. So happy Holi to you all. Thank you very much, team. Very happy to meet all of you. So please subscribe to the channel if you have not subscribed. Very happy to see you all. Happy Holi to every one of you. We will meet in the training program. Thank you very much, team. Bye bye.